Good evening, ladies and gentlemen. Today we're going to be going through a couple ways you can improve your symptoms of PTSD. So we'll go through a couple ways you can potentially improve your post-traumatic stress syndrome and reduce the severity of its impact on your life. So we'll begin by talking about psychotherapy. Starting off with our first slide here, emotional freedom technique. So the emotional freedom technique is similar in effectiveness to CBT, cognitive behavioral therapy, and it's also similar to effectiveness in EMDR, eye movement, desensitization, and reprocessing. So all three of these techniques have similar effectiveness, though there are many more studies on emotional freedom techniques. So it's kind of the safe, tried and true way. And this is actually the mainstream. These psychotherapy techniques are the mainstream go-to treatment for PTSD, I believe. So if you have been treated for PTSD, you might have experienced this therapeutic technique before. It is effective though. In one study, it fixed PTSD in youth pretty much. You can see this study here, the IES pre and IES post. So the impact of events score, pre-treatment and post-treatment. The red line is those who experienced emotional freedom technique, and the blue line is controls who did not experience psychotherapy. So you can see it practically eliminated symptoms of PTSD, intrusive memories, basically disappeared, avoidance, also basically avoidance of traumatic memories also basically disappeared. So it was very effective in youth. Another meta-analysis study had an average reduction of 32%. Another study I looked at of veterans had a 48% reduction in symptoms of PTSD who went through the emotional freedom technique, psychotherapy. So psychotherapy is extremely effective. If psychotherapy did not work for you or you haven't tried it, try it if you haven't tried it. But if you have tried it and it didn't work, there is a backup, but it's a little bit difficult to get access to. But it's a new treatment. Hopefully it becomes more available, but it's ecstasy, MDMA, which is ecstasy, which is a party rave drug. In this study, it was used on treatment-resistant patients, so patients who psychotherapy wasn't effective. All the patients studied had a diagnosis of PTSD. There were 3 90-minute pre-sessions of psychotherapy. There were 2 to 3 8-hour sessions with either 30, 75, or 125 milligrams of MDMA given at the beginning of this 8-hour session, followed by another half dose 1.5 to 2 hours into the psychotherapy session that is being pharmaceutically assisted with MDMA. The 8-hour sessions were 1 month apart, and again, there were either 2 or 3 of these sessions, so The total time was either 2.5 or 3.5 months to do all of these things, maybe a little bit longer. After each 8-hour MDMA session, this patient stayed the night on site and followed up over the phone for 7 days, and there were another 3 90-minute sessions to integrate the experience of psychotherapy after each 8-hour session. So there were 3 pre-sessions, 1 8-hour session with MDMA, and 3 post-sessions to integrate the experience. And each of the MDMA sessions was 1 month apart. And here, this graph here, we can see the results. The primary efficacy measure, the mean CAPS-4 scale, which is a PTSD diagnostic tool. So the baseline number, they scored 82.4 on the CAPS-4 scale. And after 2 experimental sessions of MDMA, they scored 24.1 on average, which was a 71% reduction in the case of 75 milligrams. So the 75 milligram dose was the most effective dose. 125 milligrams only had a 49% reduction. 30 milligrams only had a 13% reduction. So if you do end up trying this, a 75 milligram dose is the most effective. The number of participants who met CAPS-4 PDS diagnostic criteria after being treated was 14% in the 75 milligram group, and 86% did not have a PTSD diagnosis after being treated with MDMA and psychotherapy. So in treatment-resistant patients, this therapy was 86% effective in curing people with PTSD, and all patients experienced at least a 30% decrease in their score of PTSD. So MDMA, ecstasy, is extremely effective combined with psychotherapy in pretty much curing PTSD. It's a little tricky to get your hands on MDMA. I have heard that street ecstasy you buy illegally, about 90% to 95% of it is not actually MDMA or is mixed with other drugs. So I'm not sure, it looks great on paper. I'm not sure how you'll actually do this. I know they are working in a number of countries to make this treatment available, but mostly it is not available yet. So maybe if you have this, you might be able to travel to another country that is more lenient and get it done. Or you can become an advocate and try and argue that it should be legal to have this type of therapy since it is effective, and MDMA is a very safe drug. Has a good safety profile as far as I can tell. Please do your own research on all these things, but It basically works, I believe, by releasing a ton of serotonin in your brain. So I think that's the effect mechanism. So, we'll go to the next thing. Sorry about this one not being potentially that useful. Another thing you could do is try and reduce inflammation. So Hedges G, which is a statistical measure, had a negative 0.68 association with inflammation. So if you had less inflammation, you had less PTSD. You could try, therefore, to reduce inflammation of the brain. There's a number of ways you could do that. Fish oil, curcumin, saunas, exercise. I'm not sure, but what else you could try. But you can look up how to reduce inflammation of the brain, and that might help. I wouldn't recommend but it's LSD. I believe LSD and magic mushrooms are much easier to find illegally than ecstasy. So you could try LSD. I don't recommend it. It has some similar benefits for PTSD as MDMA, but MDMA is generally considered to be safer, it's better, and it's more effective too. LSD might help. LSD is not as safe, but it could potentially help you get over these kind of ingrained traumatic experiences. So apologies for finding so few ways you can overcome PTSD. But MDMA is certainly very promising. Psychotherapy is often quite effective. But hopefully the MDMA assisted psychotherapy becomes more widely available, or at least available in one location in the world. I haven't looked up if there is one location that offers it, but as long as there's somewhere in the world that offers it, you can go there and receive treatment. I hope you found something interesting in this video. I hope it lit up a few brain cells, hopefully. And thank you for watching, and take care, everyone. Bye.